Antibiotics are not health beneficial. What is the replacement for antibiotics? The medicine experts, and the conclusion of the lab experiments insight about the negative impact of antibiotics consumption that majorly targets the intestinal microflora. One more aspect that cannot be overlooked is that the harmful bacteria dilutes efficacy of the antibiotic. The medicine think tanks and specialists believe that the best possible alternative to antibiotics is to opt for transplantation of beneficial microbes from a healthy person to a sick person. Microbiome or SOS. The gut is home to more than millions of bacteria that weigh roughly between 1 to 3 kilograms. The clinical and lab evaluation concludes that microorganisms are vital to life and health and directly attributes to longevity. The microbiome impacts cardio, physio, immune, and neurohealth too. Heredity and habits are the two, out of many factors, that the microbiome depends upon. Its composition and effects on health vary with living conditions. Change in environment impacts the count of microorganisms. It may tend to surplus, or decrease, with respect to their compatibility with the external mode. This substantiates correlation with the frequency of autoimmune diseases. It is much higher in rich countries than in poor nations. The immune system is affected by the external factors. Body is more disease resistive if a person grew up in a large family, and had a pet-like dog in the house. The more microbes in the intestine generally convey balanced microbes presence and healthy intestine functioning. However, antibiotics, which remain the main means of combating harmful bacteria, significantly reduce this diversity. As per the latest conclusion of a research, the American scientists have clearly demonstrated how a 10 days intake of antibiotics burns out millions aerobic bacteria count. The authors of the work showed that drugs negatively affect the motivation and athletic performance of athletes. Exposure to threat. The harmful effects of antibiotics on symbiotic bacteria have been known before, but none heed. Neither the medical staff nor the general public are aware of the attached health threat in taking these drugs. On the contrary, they are quick prescribed these medicines even in sneeze or cold. About this, it's now that the experts actively sounding the alarm in both Western Europe and America. The widely inappropriate consumption of antibiotics has led to the emergence of high-resistant strains. So, in 2017 in America, a case of death from a superbug resistant to 26 medicines was recorded. Although, work is on developing new kinds of antibiotics, like the synthetic make. The surge in the multidrug-resistant bacteria puts the fate of this type of drugs in question. New technique fecal transplantation is the popular method of combating harmful bacteria in the West, conceptually, replacing bacterial-infected microflora with the health ones. And this method they adopt in the treatment of liver disease, diarrhea and COVID-19 too, including fighting body's resistance to antibiotics. A case is known when microbial transplantation helped a man whose intestines produced alcohol. Transplantation of fecal microbiota is carried out from a healthy donor to a sick recipient. The microbes and compounds found in the donor's feces is attached to the recipient's intestines to help suppress harmful bacteria. The donor preference is more of a close relative than third-party donor. The donor-recipient compatibility match is altogether a different path to walk on but is an utmost part to adhere before transplantation. There are different variables to go with in the transplantation procedure: colonoscopy method, using an enema or through a tube th.